folks, and thanks everyone for being brave enough to introduce yourselves. My name is Rachel McLean. I use she, her pronouns, and I work at the Canadian Public Health Association. So of course, today we're going to hear from Faye Johnstone from Wisdom2Action, sorry, really focusing on exploring gaps in youth suicide prevention research. So I know I'm super looking forward to hearing from Faye and sort of some of the research that they've found and some of the existing gaps. So very quickly, oh, my screen is, there we go. Sorry about that. My screen was frozen for a minute. So as I mentioned, I work at the Canadian Public Health Association, which is located in Ottawa, Ontario. And so I just want to begin the session by first acknowledging that CPHA's office, as well as where I'm located today, is located on the original unceded territory of the Algonquin Anishinaabe people. And they have been guardians of this land for millennia, and CPHA and myself as well are grateful for the example their stewardship provides and for the opportunity to gather on this land and learn with each other. So I think at this point, probably a lot of you are familiar with Zoom, but it can be a little confusing because there are a lot of video conference platforms being used. You should be hearing me right now. If you are having any issues either seeing the slides or participating in any of the interactive activities today, you can message me directly in the chat. So you'll see my name, it shows up as CPHA webinars, and I'll do my best to troubleshoot any issues for you. I'm sure Faye will cover this a little bit more, but this will be a very interactive session. We do encourage you to participate using both your webcam and your microphone. And so you will see that you can start your mic, or you can mute and unmute yourself, and also start or stop your video in the bottom left hand of your screen. The last thing, for those of you that don't want to use your microphone or, for whatever reason, we completely respect that and understand that. You can also use the chat function to share your thoughts or to ask questions throughout the webinar today. And then lastly, just a quick note that the webinar is being recorded. What that means is when we do record it, the videos of the speakers will be shown in the top right hand of the screen. And so if you'd rather not have your face or your name in the recording, you can turn off your screen if you do choose to talk. You can also actually rename yourself if you'd rather use a different name. So for those of you, and again, I'm sure a lot of you know this, but for those of you that aren't yet sure, a little quick tip is if you click on your video in the top right corner, you'll see 3 little dots. If you click on that, there's actually an option to rename yourself. So you can use any name you like, or an alias, whatever you want to use. So just wanted to caution folks that when we do the recording, your name and your video will appear unless you sort of change your name or decide to turn your video off. So with that, I will turn it over to Faye.
I think a great way is to be trans, change your name, and then no one knows who you might have used to be recorded under, and then you're just good to go and nobody can hold you accountable for anything. Awesome. Hi, folks. My name is Faye Johnstone. I am a principal consultant with Wisdom2Action, currently trying to avoid the sun so you can actually see my face. I'm going to start by sharing my screen, but I think that requires that, Rachel, you stop sharing your screen. And so I will just give her a second. Perfect. And can folks just give me a thumbs up if you're able to see a PowerPoint slide on your screen at this moment? Perfect. In terms of myself, as I said, my name is Faye Johnstone. I use she and they pronouns, either or, mix them up, keep it fun and funky, and whatever works best for you. I am joining folks from unceded, unstranded Algonquin territory, and my team is based in Mi'kma'ki in Nova Scotia, so Halifax. I do want to emphasize from the very get-go and encourage folks to figure out the land that they are residing upon, figure out the first peoples of that land, and do work to build relationships with those folks to understand local issues, participate in solidarity actions, and in every way possible, continue the narrative and work to decolonize our work, our approach, and our spaces. I work with Wisdom2Action. We are a progressive consulting firm and social enterprise, mostly working in the world of mental health, 2S LGBT communities, gender-based violence, and specifically in knowledge mobilization and community engagement, more so than anything else. So we spend a lot of our time helping organizations, clients, and partners connect with communities that they want to consult with or co-create interventions with, then helping to actually take what we know in community and mobilize it in an effective way. And we do that both in terms of uplifting community-based knowledge and bringing it into new settings and spaces, but also helping academic knowledge and more formal evidence trickle out into community settings to practitioners to help them do the work that they're already doing, but even better. Does that make sense in terms of who I am and what I'm up to today? Awesome. You can check out more about what we do at www.wisdom2action.org. We've got a phenomenal set of resources on everything in the worlds of mental health, GBV, inclusion, etc. And we are always happy to hear from more folks and do more fun work. Before I get too far into it, I do, as Rachel was saying, you are welcome to mute or unmute yourself. I tend to start speaking and then I rarely tend to stop. And so that does sometimes require jumping in because I can't see your faces all at the same time. And so please don't hesitate to do so because I do want to make this as interactive as possible. I am a creative facilitator by training, and so I'm used to spending my time in big rooms with a circle, like 17 cups of coffee and a lot of fun conversations. Plus like sticky notes, pipe cleaners, Play-Doh, and who in God's name knows what else. If your internet is being icky or tricky, just turn off your video and it often fixes the issue. I found that depends on how many folks are in a Zoom meeting, and we have a fair chunk of folks today, but play it by ear and we will let you back in if you disconnect. If you're having a hard time jumping into the convo, you are welcome to raise your hand. You actually have a feature in the chat where you can raise your hand and it like gives me a little icon. So you can do that, or you can literally just interrupt me. Like I will not take it personally, or jump into the chat itself and we'll try to find a way to make it work. I'm almost done my housekeeping. I just think it's always important to do it well. You also you know your body best. I find that especially in the world of Zoom, we are so used to like this interaction and smiling and engaging, and those are really great things, but you also know yourself and you know what your body needs, and you can pout, you can also turn your camera off, or you can go grab your coffee, and nobody needs to be the wiser because you know your needs best. I also want to encourage folks to step into this conversation from hopefully a braver and a safer space. What I mean by that is, I think when I say a braver space, I mean a space that challenges ourselves, where we ask the hard question. In the world of social services and social issues, we often have a very strong association with the idea of like always having the right questions and the right ways of saying things and speaking out into the world. But that's not always accessible to folks. And sometimes we have an awkward, weird question and we don't know how to ask it right. And so my message is to try and just ask it, and we can work with you from there. Because we do want to, put everything on the table and genuinely engage in this conversation wholesomely. And then finally, I do want to create a space where we think about different communities. We know that the topic of youth suicide prevention is a massive topic to unpack, but we know that the impact of systems of racism and sexism, homophobia and transphobia, classism and ableism all shape how we as individuals and communities interact with one another, our access to healthcare, our statistical ability to just be well in a world that isn't always nice to us. And so I do encourage folks to bring that lens forward in this conversation, if and when we can, to just as much as we can do justice to the massive diversity of young folks who are impacted by this issue. Does all of that make sense to y'all? Okay, the 5 people I can see on the screen are giving me thumbs up, so I'm assuming they are a good sample for everybody else. So get into the actual fun stuff, and to give a bit of a project background of why we are all convening today and why, what the focus of this work and this conversation will be. In 2020, Wisdom2Action was selected by the Public Health Agency of Canada and the Mental Health Commission of Canada to undertake a project exploring gaps in youth suicide prevention and knowledge mobilization. What that means in practice is we are looking at what research do we have in academia around youth suicide prevention, like what do we actually know, specifically in a Canadian context. And then what do we not know? Like where are the areas both in like the empirical, like the academic research where there isn't enough information, where there isn't relevant research published on specific topics, for example, the interconnection between substance use and suicidality, among young folks under the age of 16, for example. So how do we pull out some of those areas where we don't know enough, but also what isn't reaching providers and young folks and families? Because it's one thing to have a wonderfully diverse body of research, and it's a very different thing to translate that into practice, to ensure that folks have the right knowledge and tools to intervene when they can, to support folks who are struggling with suicidality, and to help ensure that our supports are truly effective at improving outcomes for young folks. All of this is based off of prior work by the Public Health Agency of Canada and the Mental Health Commission of Canada to explore broader gaps in Canada's not youth-specific, but general suicide prevention agenda. And following that, a number of firms were selected or organizations were selected to undertake specific targeted reviews of the research on particular communities or subgroups. So in this case, young folks, but there's other work underway looking at seniors, looking at boys and men, looking at the unique context of 2S LGBTQ communities, et cetera, et cetera. The end objective on our part is very much to strengthen our understanding of gaps in youth suicide prevention research and knowledge mobilization, all of which will hopefully inform Canada's suicide prevention research strategy, and hopefully will help all of our organizations across sectors better understand suicide prevention and youth suicide prevention, and better understand how to mobilize the available data to have an impact on the lives of young folks. In terms of what that looks like, our role has three key components. The first one is to do the academic review, so to look at what's out there, what's been published and what's missing. The second one is to find out if what we're hearing and seeing in academia mirrors or matches or in any way diverts from what we're seeing and hearing among young folks, families, service providers, and researchers. So that is the second piece, is very much engaging with everybody we can talk to about this topic, and that is very much the focus of our time together today. And then the third piece is, of course, reporting back to the Public Health Agency and the MHCC around what we heard to help so that these conversations can inform their broader research agenda. Does all of that contextual information make sense to folks? Are there any questions at this point? You're welcome again to use the chat, to start yelling at me over audio, like whatever works for you best. Perfect. If you do ask any questions in the chat, I will do my best to notice them right away. I will plead guilty to having a lot of things on my screen, and I am like talking at y'all at the same time. So it might take me a minute, but I do promise to address anything that comes up. So today our process is very much to review a bit of what we have done and what we've heard so far and what we're seeing, but then to get your perspective, let you weigh in on what gaps exist in this, on this subject, how we can better mobilize the research and evidence that we do have, etc. So we'll start with a bit of general brainstorming, and then we will, throughout the time, the course of our time together, zoom in, narrow in, and talk through what we've already seen and heard and how you might relate to that, to what we've already heard from other folks. So I'm also going to try something out because we have a fair chunk of folks on our call today. I think we're sitting at 55 participants at the moment. So I'm going to get everyone to go and open up their chat feature. And I'm going to, in a moment, copy paste a link. That link is going to take you to a thing called Google Jamboard. Google Jamboards is a facilitation platform, so it allows us to work together to add ideas or thoughts or perspectives on stuff. And so I'm going to get everyone to jump over to there, and then we will take it from there. We'll do a bit of jumping back and forth, but as little as we can just to keep it as easy as possible. So if you give me 1 second to pull up my link, which is right here. You get to see my Gmail. I'm sorry. There's nothing exciting going on, I promise. And then I get to go back over here and perfect. If everyone can click that wonderful link, it should bring you up into a page that looks just like this. And I'm already seeing folks trickling in very big numbers. So that is amazing. So I will give folks a second to trickle onto this platform, and thank you for jumping and working with me as we migrate from one thing to another. I think we're all probably a bit too used to Zoom, so it's fun to change things up on occasion. So the way that Google Jamboards works is I get to type a big question and I basically get to get your thoughts on it. If you look at the left of your screen, there is a little set of tools you can use, and I'm going to get you to use the fourth one, which pops up a little sticky note where you can type, hi, this is a sticky note. And then you can click to save it, and it actually just shows up on my screen like this. And so this is a way that we can all hopefully participate in this conversation, because it's hard for 50+ people to all unmute themselves at the same time. And so I'm hoping that we can do a combo of folks speaking with their mics, but also folks using the Google Jamboards to share their perspectives, echo what other folks are saying, etc. Does that make sense to folks? Does this sound like a thing that could be worth trying out? Okay. So
hey, I'll just jump in there because I know you're juggling a lot of things. It looks like we're in view only. So if you can give us editing capability,
yes,
then we'll be good to go. And it looks like one of the rooms is maxed out. So maybe if you could share another.
Yes, indeed. I've got room number 2. I will send it into the chat in 2 seconds. Thank you, Rachel.
Thank you.
Just gotta set it up so you're actually able to view the thing. Anyone with the link, editor. Okay, so folks who are already in the current Jamboards, do not click that link. That link is the second Jamboards, and in a second, you should all be able to edit. You might have to refresh your page, but you should, using this link, if you are able to edit or refresh your page, you should be good to go. Are folks able to mess around on here now? Yes, okay. So the note is that these are 2 different, they're not like what's on one won't translate necessarily to the other, but I will jump back and forth between, and we will make sure that everything from both sides is rolled together. So if you're not on like one of them, do not worry about it. Okay, so the first question, and again, feel free to type in your sticky notes or join verbally. From your perspective, just on the broadest level possible, what are the primary gaps that you see on youth suicide prevention research? What do we not know? And I know that's a big question, and I'm actually intending it to be that way. So if you had to answer it, what would you start with? Where would you start? I can see everyone's eyes go like, oh goodness. I see, what do we know about socioeconomic status and youth suicide? That is something that we have also noted as a bit of a gap. Like, I don't think there is much that looks at the relationship between young folks who are growing up in poverty, for example, and prevalence of suicidality or suicidal ideation. I also do want to flag at this point, just to give a trigger warning if you're going into anything of graphic detail, just because we don't know what folks' personal experiences might be in this space, and we want to avoid super like gritty experiences that might be difficult for other folks to hear and process. So just keep that in mind, and I might jump in if something does come up, and we are always just a message away if you need to chat. Oh, I love how quickly this is moving. So we've got, oh my goodness, y'all, what tools are available to a family so that they can help? I think that's one of the biggest things, especially in terms of knowledge mobilization gaps, is we know there are tools, but nobody knows what they actually are, on the family side at least. So how do we get those out to folks in a better way? What are the best practices in risk assessment, particularly in the context of a global pandemic, such as COVID-19? What are the best practices in the prevention, in suicide prevention strategies during COVID-19? I think there's a big chunk of like COVID-19 related research that will hopefully like come following the world going back to some degree of normal. So I think it would be interesting to understand, we don't know much about suicide response or suicide prevention during a pandemic like this, or necessarily its impact. There's a lot of research that's coming out around how COVID has increased prevalence of mental health issues that young folks are experiencing, but how does that directly translate into prevalence of suicidality? I'm not sure.
I tried to get my daughter to help me with this and didn't work out so well.
Yeah,
so
totally fair.
I'll just jump in if you don't mind. I work with youth primarily in the four school boards in my region. And one thing I'll just share from their perspective, what might be a gap is there are lots of services, But when it comes to services, are those services really meeting the needs of youth the way they need them? So for example, Kids Help Phone, they've adapted and had the live chat and then the texting feature. And I've heard from young people that prior to that, yes, there were calls to Kids Help Phone, but they wish they would feel much more comfortable texting somebody for the most part. So using that model, are we in all parts of, the province or Canada, depending on how far this research goes, have we consulted with young people who are at risk or who are struggling, and are the services that they're actually utilizing meeting their needs? I guess that's what I would put if I could type on here.
Yeah, I love that. Thank you so much. I think the question of co-design in like youth suicide prevention services, even like how are we working with young folks to create the interventions and then evaluate those interventions? Where are young folks in that conversation? I think is a huge issue. Y'all are really like, so I used this a couple months ago for a focus group of 100 people, and you all have like 10 times as many sticky notes as they do already, which is impressive and slightly terrifying. I am seeing differentiation between suicidal ideation and folks who have experienced or survived a suicide attempt. What factors lead to one versus the other? I'm seeing how can family, friends, or other folks connected to you or in your circle notice and intervene? How can they reduce the impact or risk of future issues? I think some folks are still only able to view. But we've got stuff over here too, which is awesome. Hello, Anonymous Wolf. I love that it chooses animals. I think that's cute. Follow-up services for youth at risk of suicide, links between social determinants of health and how they impact suicidality, wraparound and integrated collaborative services. Very nice. You can also change the color of your sticky notes, as some people have figured out, which I think is very fun. So I'm actually gonna pause us now, and I'm gonna move us back to my screen over here. And I'm gonna ask folks to take it to a level a little bit deeper. So I think we've got a lot of really good, broad, contextual pieces that make a lot of sense, but I wanna think about the spectrum of intervention. So when we think about promotion, what don't we know? When we think about clinical intervention, treatment, in a very traditional sense, what don't we know? Reflect on different communities that might have higher prevalences of suicidality, and then think beyond what we actually currently know. What could we do differently? What are new interventions that could be worth exploring? What areas do we just not have next to any idea if they're connected to, related to, or positively impact suicidality? What do we know, for example, about like land-based activities and suicide prevention? Or physical activities, like literally going for a run and like youth suicide prevention. Like what are some of those pieces? So I'm gonna go back here and keep that in mind. And I would encourage folks like, think a bit about the clinical component there as well, because I'm not sure if we've dived into it as much as we could. If you're not able to type into the Google Jamboards, you can also just type into the chat and I will be able to look back and figure out like at which question you were engaging with what, so I can slot that in on my end after. I'm seeing the ratio of sticky notes per second decreasing, so I'm gonna pull us back. My next question is similarly, let's pause for a moment and think, what else haven't we thought about? What are we missing? What are other gaps or themes? And the next slide is actually an overview of the gaps and themes that we have identified. So I'll review that first, and then maybe I want to go back to and see what else might be missing. So the key themes, as part of our research process, we undertook a literature review of just about every single article that was published in a Canadian paper or by a Canadian institution in the world of youth suicide prevention. From there, we screened and screened and screened to remove ones that weren't applicable, that just mentioned suicidality, but not in a specific or targeted way. And some of the main themes that we identified where there just wasn't enough research, where we didn't have much evidence, were racism, colonialism, and suicidality. So what do we know about the ways in which racism as a system Not just like specific instances of necessarily, but including that. How does that relate to experience of suicidality and youth suicidality? What is the connection between homelessness and suicide, substance use and suicide, bullying? And when we say bullying in this context, I mean both the micro, like not to put a severity scale on bullying, but I mean both like instances of abuse directed at children by other children and young folks, but also what is like more conventionally like teasing and name calling, et cetera, like that whole spectrum of bullying experiences. One area that we've increasingly found almost very little evidence around beyond like statistical prevalence issues is around homophobia, transphobia, and suicide. So we know a fair chunk about the prevalence of suicidality in 2S LGBTQ communities, but we don't necessarily know much beyond that. The best evidence that we have says that supportive parents are the biggest determinant, that prevalence of suicidality massively plummets in instances where folks have supportive and affirming parents and caregivers around them. But we don't know much beyond that, and we don't have much evidence on what interventions specifically work in 2S LGBTQ. And so that's very similar for, we have a lot of evidence around like race and suicidality in the broader demographic sense, but we don't necessarily have all that much around services that are like race-based. So services specific to BIPOC folks, Black folks, Indigenous folks, and their relationship to youth suicide prevention. We don't know much of anything around chronic pain and suicide. We know some pieces around the connection between mood disorders and suicide, and there's all of those wonderful warnings on any bottle of pills around the possible connections between, but we still don't have tons around, I think, like comorbidity. So when you have multiple diagnoses or multiple mental health or neurodiversity related issues going on, such as ADHD and autism, and we don't know much around eating disorders and suicide. That is not by any means a comprehensive list. The list of gaps just goes on and on and on, because we do have a lot more research to do, but that is intended to give us a bit of an idea to the common themes that are emerging on our end, just from the research components, rather than from service providers, families, and young folks themselves. What do you folks think of these themes? Is there anything here that really stands out to you? Anything that you're curious about within the themes? And this is, you are welcome to unmute yourself. You're welcome to use the chat function, whatever works for you. Okay, hearing nothing. I'm gonna shuffle us over to the second question. So I think it's one thing to identify all of the billions of gaps in youth suicide prevention. I think that is a valuable exercise, but I also think that we need to move beyond a long, exhaustive list of every issue. And so at this point, I'd encourage everybody that can to open up one sticky note, and within that sticky note to write out your top 3 priorities. If you could only choose 3 areas where you really knew that we need to strengthen youth suicide prevention research in those 3 areas, what would they be? And the reason for that is that we want to report back both with a list of gaps, but also an understanding of which gaps are most salient, most relevant, and most important to young folks, service providers, and families for us to act on ambitiously and urgently. So if folks want to jump back in, I'm not sure if people still have open. I hope you did. If you did not, the link is still indeed in your chat. You can also rank them if you want to, like 1, 2, 3, but you don't have to. Whatever works best on that front. I'm seeing something around folks who are interested in women and girls with ADHD and suicide. I think that is very interesting. I think that there's also a broader conversation around how ADHD and autism are like undiagnosed typically in young girls. And I wonder how that connects to the issue. Like if folks, like how do we account for folks who might not be diagnosed but are struggling with ADHD or autism, and that might be connected to feelings of disconnectedness and like other broader issues that might be going on with their health and well-being. I'm seeing LGBTQ, homophobia, transphobia, indigenous knowledges on youth suicide prevention, evidence-based prevention, curriculum with solid evaluation and measured outcomes. Yes, please. I see a big one around medication and safety among youth. I think sexual assault and suicidality is a huge issue. And I think there's not much out there that I have seen, at least on that front. Despite it being, I think it's interesting at some points to think about what we talk about a lot versus what we actually know. And I think there's often a significant disconnect because I know that QSLGQ young folks have higher rates of suicidality, but we don't know much beyond that. But it might give the assumption or the feeling that we know more than we actually do. I keep forgetting that the sticky notes like stack if everyone like saves them at the same time, so I have to move them, but this is awesome. Okay. How do we create youth-friendly services? And that's it, like I like that I'm seeing the full spectrum. We're talking both around like co-creation of youth services and also like clinical evidence to support the efficacy of youth suicide prevention services. And I like that. Increasing services and supports for marginalized communities, how to provide a trauma, or I'm extrapolating here, how to provide a trauma-informed lens to suicide prevention. How do you support folks who are directly affected? Like when I say like suicide prevention, I also mean like supports for folks who might have experienced like losing a friend, post-vention supports, what comes following somebody having completed the suicide attempt, what evolves from there to help protect other folks who might be impacted. Chronic pain and suicide, concussion and suicide is very interesting. I had not thought of that to date. I'm seeing the role and interplay between religion and other risk factors to protect young folks. So where does religion come into this? Where does support for faith-based communities come in as potentially a resiliency factor to prevent suicidality? But on the other side, how can religion and spirituality not be a protective factor? How can it put folks in more vulnerable contexts in some cases? How do schools respond when there is somebody who completes a suicide in their community? How do you protect the other young folks? I know there's a lot of work underway in Ontario right now around youth suicide prevention and in a lot of jurisdictions, but I think we are wrangling with what does like a community response to a completed suicide look like? How do we actually go in and support parents, support families, support young folks, but also support service providers to do that work? And so I think there's a whole can of worms there. Very nice. Okay, I'm going to bring us back to my screen. Oh, I just clicked the wrong button. Oh no. So I know that we probably could go into the like prior or the identification of gaps in youth suicide prevention research for ages and ages on end. But the next piece that I think is actually, on my end at least, the most interesting is exploring where the knowledge mobilization is at. So exploring on one front, for service providers in particular with us today, how do you learn about suicide prevention? Where did you access that information? Who decided to be like, hey, you need to have a bit of knowledge around this? And was it effective? Did you get the knowledge you needed? And so I'm going to bring folks back to here again. And our next slide is, where do you currently access youth knowledge and research on youth suicide prevention? Do you have tools in your workplace? What do those look like? how do you, if you have knowledge, even if it's like a little bit of knowledge around youth suicide prevention, where did it come from? And if you don't, where do you wish it was coming from? Mental health literacy curriculum and training, nice. I know that there's a lot going on for teachers and educators. I know the Ontario context best, but there's a lot of work through School Mental Health Ontario, supporting schools and educators to think critically about mental health and have the literacy that they need. Where else are folks hearing things? How are you learning about this? Is it all like, are you learning about this? Is the verdict that you aren't getting information? Here I'm seeing primarily nonprofits and mental health or suicide prevention focused organizations. I also think that folks should probably, like, if you see stuff you don't know about, you can write it down and Google it later. I do think there's an immense value in sharing how we all access information just in and of itself, because it helps us better understand how to and where to access information. Alberta Health Services, documents on suicide prevention, online training manuals, with statistics rather than prevention. Following researchers on social media. I love that. I think that Twitter is probably my best source of information from one day to the next. But yes, I do verify to make sure that it is not fake news. And you should too. I'm seeing regional suicide prevention coalitions, very nice. If folks don't know, another resource that I am always a big fan of is Together to Live, I believe it's .ca. It is a youth suicide prevention toolkit created by the Ontario Centre of Excellence for Child and Youth Mental Health, based out of CHIO. I might have helped author some of the youth engagement related sections, so I'm a bit biased, but it is a very valuable resource. For parents, like, where are parents learning or hearing about this? I have a question from somebody in the chat saying, I feel like we should be talking more about the workplace, like private industries, rather than just about health and education. Do you learn about youth suicide prevention in the workplace? How could you? Center for Suicide Prevention, assist suicide prevention training, or applied suicide skill. I can't remember the assist acronym anymore, but applied suicide intervention skills training. There we go. Assist is very valuable. I also recommend, like, as just the concept. I used to be like a camp counselor and a lifeguard, and the best suicide prevention skills I ever gained was standard first aid. Just how to walk folks down from a panic attack is, and out of shock, and support folks who might be experiencing shock is one of the best ways to know how to keep somebody talking when they don't necessarily want to be talking. For the person who's asking about the slides, they will indeed be shared. I will be sharing both a summary of the sticky notes, as well as the slides themselves will be sent out following, I believe. What else are we seeing here? University of Michigan. I like when people get precise. That is actually, there's a nice link here that folks should check out. I'm seeing the Youth and Family League for Peel, for Project Now in Peel. Very cool. I've heard about very good work associated with Project Zero. Peer support services through CMHO and Parents for Children's Mental Health Ontario. Always a big fan of Parents for Children's Mental Health Ontario, or for Children's Mental Health. They are awesome folks. What about, I actually want to zoom in on this, like, workplace component. Can I get like a show of hands? Like, are folks learning about youth suicide prevention or or suicidality in general within your workplaces? Is it a thing that is being talked about? I'm seeing some yeses. I feel like some of the yeses are from people who work in children's mental health or mental health spaces, so you don't count. But everybody else.
Okay, to add to that, I was just gonna say, so this is how I heard about this. Our Suicide Prevention Coalition chair forwarded this information, and then organizations forwarded it to their staff, but it often ends with people who have a specific interest in youth mental health. So then the rest, like, unless there's interest, it's optional. I don't know that there's a lot being offered necessarily for everyone, or is it, like, I think it was sent to me because I work in that space. I'm not even sure if the entire staff received this opportunity. So
and that's part of the, like, part of the thing that we're even struggling with on our end is how do we reach that, like, so we're doing a lot. So in terms of like how we're bringing in information for this project, we've got a virtual survey. We're doing focus groups and webinars like this with as many partners as we are able to reach. And we're also, again, we're doing key informant interviews and chatting one-on-one with folks. But it is a question of how do you reach, like, the person I most want to talk to is parents who has never heard anything about suicide prevention.
Can I just add something there?
Yes, please do.
I worked in the trucking industry all my life, and I've had a few of my friends who have suicided through it. And I pushed for the last 15 years of my working career to get training in it. I'm a Safe Talk trainer, and trying to get them interested in it, to try and save. But if we talk to the people, the ordinary people, the parents that are not in the health industry, in the education history, these are the ones that are going to prevent it. The ones in the schools, it's great. We could all talk all we want. We could talk, I'm a TAMI speaker. I could go out and speak about whatever I want, but it's the parents that have to be trained to see what's happening with their own kids. And if we could start training the workplaces to look, not only at, it will teach the employees to look at their kids, but it teaches the employers to look at the employees also. So like it will be preventing adult suicides, and we'd be preventing child suicide or youth suicide. It's a ladder going up and it's a ladder going down, and we have to work at both ends of the ladder. That's my impression anyways.
100%, I hear you. And I think I wondered like so actually I think that moves me to my next question, which is, I'm actually gonna jump this one and we'll go back to it. But for slide 5, what would be effective ways to reach more people? Like I think, again, it's great to acknowledge the gaps, but I think the area that is tricky is, as Stephen, as you were saying, we actually need to intervene. We need interventions that reach the right people in the right context with the right information. And so what could we be doing? How could we more effectively reach young folks, service providers? Because I also think that the average practitioner in youth mental health doesn't necessarily have like precise expertise in suicide prevention. And they don't necessarily need to have like buckets and buckets, but how do we make sure that that information is where they need it to be in those moments when they need it?
We have to start pushing industries.
Yeah.
And the industries are going to be putting the education on their employees, or not pushing it on them, but giving their employees a chance to get educated on this. And we have to get them talking there. And like I just said, it's a ladder up and down, and it will start trickling down at probably a faster rate because people will become more aware of suicide.
Yeah.
When, like I'm in the Cornwall area, and when you hear about the amount of suicide with the kids here, and the parents are not hearing about it, or the parents, some people are, some people aren't. I talk to some people and they say, well, I never knew there was any kids dying in this area. But we have to educate. It's great to help the kids, all we have to, but we have to educate the adults first.
Yeah.
And because
I'm seeing in the chat, I'm seeing
we're ignorant. A lot of the adults are ignorant towards it. And I'm not talking in a derogatory manner. It's they just don't realize it's happening.
Yeah.
It didn't happen to them.
Definitely. So I'm seeing in the Jamboards, I'm seeing go where families are at. But actually, do we want websites? Do we want like toolkits? Do we want webinars? Do we want formal training programs? Do we want seminars? Like, what are some of the specific like mechanisms that we can actually share the information? I think like both where do we share it and how do we share it? I'm seeing make connection with school divisions, great, and to create parent sessions. I think schools are, I think workplaces are a phenomenal place to intervene. I also do think schools have a huge role to play in sharing information. They can connect with parents in person, on an ongoing basis, and share info. I'm seeing social media awareness for young folks, working with schools, toolkits, self-directed learning. TikTok videos, I think, is great and very much with the trend. I say as somebody who has never downloaded and will never download TikTok. What else are we seeing, folks? Anybody, anything that we're missing in this? I see education is a big piece. How about peer education? Like parents talking to parents, I think is a really valuable intervention.
Like
young
Pleo?
folks talking to young folks.
Like in your region, Pleo, Parents Lifeline,
Yes.
Eastern Ontario, that's a fantastic program. And they did a few videos that they posted on their website exactly about what you're talking about for parents. So that's a good one. Another program of CMHA Ontario is Talk Today, where you provide safe talk education to athletes, particularly hockey.
Mm-hmm.
I love that approach. You know,
as a former hockey player, there was a whole thing going on in like young boys' mentalities and mindsets and sports dynamics, and like, good Lord, we need to intervene in that space.
So the people in those spaces, like Stephen said, a truck driver educating a truck driver, an athlete educating their peers, a young taking employees, educating employees, you know, frontline to frontline. I love that approach where I think parents to parents, what you're saying makes a lot of sense.
I like that. I'm actually going to quote you on a truck driver educating a truck driver. I think that is a phenomenal line. And I think that's a big part of it is I don't think, we talk about this a lot in like, it's not appropriate for like a straight person to go in and talk to queer folks around like issues, but I also think like it is like, how do we help folks from communities educate their own communities? And how do we help folks do it in a way that isn't reinforcing icky concepts that are like ingrained in Western ideologies and Western like white supremacy and everything that goes from there? But like, how do we help folks do the work that we know they have the ability to do, that we just need to be able to support them in doing? Anything else, folks? Like, what are other, maybe, so I think we've got a lot here for parents. I actually want to think more about young folks. I wonder how can we, I know I'm making assumptions here, but I'm guessing not everyone here is under the age of 29. And if you are not, you are just as welcome to jump on in with some thoughts. How can we better reach young folks? And how do we help make sure it's the right stuff for young folks? Because I think one of the risks I see is that we inundate young folks with a lot of different mental health information. Not all of it is correct, and not all of it is structured in a way that might work for them. I see jack.org is a great piece, creating zines for young folks to raise awareness. I like that zines have made like a comeback in such a great way. Especially like, I credit the feminists for making this happen, but like they are everywhere. I have friends who have just like bookshelves full of them. What else can we do to reach young folks? Low barrier in every possible sense. I like that. I also like I think like the, what doesn't work when it comes to reaching folks at the same time? Like, do we think, what are some approaches that folks are finding aren't effective to share knowledge?
Preaching.
Preaching, yes. I personally, as a facilitator, I cannot, like 3-hour workshops or like lectures are not, I need more than that.
I don't think there's a place to connect with
suicide. There's a place to connect with suicide is, can be an outcome of poor mental health, and that we should also discuss working on like social determinants of health and promoting general wellness as part of youth suicide prevention and intervention. I love that. If folks do need to step away, because I know at least one person has to, do not hesitate. You're welcome to say goodbye. You're welcome to bail in whatever way, shape, or form works for you. Anything else? What else? How else can we reach folks? Oh, sometimes like I see it lull and then it just keeps going. Pop-ups in the community, go where the youth are. I think the low barrier piece. I'm going to pop over to this one and see what we've got here. Our government needs to have a bigger stake in suicide prevention through policy and action on social determinants of health. I think it'd be interesting to scale what it would look like for everybody to have their basic needs met, and what that does to suicidality in this country. Like, what actually is the connection between, again, like poverty and suicidality and poor mental health? I see partner with youth wellness hubs, so Youth Wellness Hubs Ontario. There's also other models outside of Ontario, so Access Open Minds, Frame, Foundry. Kickstand. There are phenomenal integrated youth service programs and hubs being implemented across the country that hopefully will help us do this work and do it more effectively. Okay, I'm gonna steal back my screen now. Well, actually, I'm gonna bring up my PowerPoint again, rather. So we've gone through a few pieces. So I'm always surprised with the focus group because I think we had planned, Rachel, to go till 2:30. I think I may have another 10 minutes or so. So I wanna pause at this point and I do wanna ask what's missing. And I know this is a bit of a like different kind of webinar than folks probably were expecting to have signed up for. I am not coming here to talk at you for an hour and a half around like what we know about youth suicide, but to hopefully pull some of that knowledge from folks. But what's been missing from this so far? What have we not talked about in the world of youth suicide prevention? And then I'll wrap up with some next steps in terms of where we go from here in terms of our reporting, but also what our commitment looks like to this issue more broadly and making sure that we're moving it forward. So what's been missing? What have we not talked about? I see some people who are hesitating and I know that you have something to say and you are welcome to unmute yourself without me putting you on the spot because you have a right to pass.
I'm trying to think what it was called, but since I've been on the Suicide Prevention Coalition since 2010, so it's going on 11 years, or it's been 11 years, I've connected with CMHA, no, sorry, not CMHA, the Suicide Prevention Coalition of Ottawa,
yeah,
which is called something else now. And they've been guiding us, and I can't remember what it's called, but they said they wanted to help us develop a plan when there's, and I'll just explain it, maybe you have a word for it. But when there's a suicide in a community, in Ottawa, there is every organization, and you may know this, there is a go-to person who then dispatches all kinds of information within hours of that suicide happening. And I feel like that's missing, you know, the supports, no one knows, everybody's scrambling, it's crisis mode. I feel like every community needs this. So this is what we want to work at with our Suicide Prevention Coalition in our post-vention prevention, is kind of mobilizing that in modeling Ottawa, but also hopefully other communities could do the same. But I don't remember what her role was exactly. She had a specific title. I don't know if you remember, Stephen.
So, was it Andrea Poncia?
Yes.
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 I love Andrea.
Okay. Thank you. If you could take it from there, I'm not. Yeah.
So I think like, so one of the things, again, like for background context on me, I used to work for the Ontario Centre of Excellence for Child Youth Mental Health. And so like, I was slotted into some of the provincial work around youth suicide prevention. And so I am not a like deep dive expert on the world of suicide prevention research, but I got my little bits and pieces. And we've got researchers on our teams who are handling the literature review and the deeper dive into the academic universe. But what some of the things that we're noticing, and I think the sector is talking about more, is how do we coordinate a response? Because what often happens, and I think this emerged when there were a few very big media explosions in the last 5 or 6 years where everyone was caught off guard. Specifically, everyone became a spokesperson almost at the same time. And when you have a crisis, when you have a very complicated crisis with a billion risk factors to weigh, a clearly communicated response is often like the most important thing. Like you need an organization that is taking the lead, that is coordinating and helping manage what everybody is doing. And I think that is something that we are looking at in terms of like gaps in prevention, is actually how do we take, like if we know this is a model that is working, because we like, I don't know what the evidence around it is, but we know that it is at least like clarifying structures through which to respond rather than absolute chaos. Like how do we actually look at models like the Suicide Prevention Network in Ottawa and say, actually, like this is a promising intervention. We need to find ways to scale this. Because I think there's both there's the research gap, there's the we don't know enough, there's the knowledge gap, there's the we don't translate it into practice enough, but there's also the scaling issue. Like how do we take successful initiatives? How do we evaluate those? And then how do we take those, implement them in different communities and adapt them to meet unique contexts? And I think that's often where we get lost.
And she was saying the 24 hours after a suicide, particularly with young people, is the most critical point of connecting them to a support to prevent further suicides. So that's the piece that I'm really interested in with our coalition, is exploring that further. But it's a big piece because it means collaborating with many organizations, schools. But I think it's manageable because it's being done in Ottawa. I know we're a smaller community, but we can do this. We can do this.
I love it. So at this point, I'm gonna shift, and I want to kind of talk about where we're going to go next. So our next steps is that for the next few months, we are trying to talk to everybody and anybody, as has been the purpose to some extent today. And so I do want to encourage folks to reach out. I'm very happy to have a deep dive conversation one-on-one with folks to explore this topic in more detail. I am happy for you to send me people. I will email random folks and say, hey, we should chat. You are also very welcome. We have a survey on our website at the moment. So you can go to www.wisdom2action.org/YSP. And I'll actually bring it up now because I'm still sharing my screen. And so if you check out the site, we do have details here around the survey, focus group registration, and signing up for a key informant interview. We have a youth advisory committee that is guiding all of the work on this project and has been phenomenal, helping us understand and synthesize what we're finding and hearing. Our commitment is that we will be doing this work until our final report to the Mental Health Commission and Public Health Agency of Canada that will summarize and emphasize our recommendations for moving this issue forward. So both providing an overview of what the primary gaps were, but also providing some insights in terms of where to go from here. Our next step is, following that, all of the different teams that are working on the population-specific recommendations. So young men and boys, 2S LGBTQ, rural and remote, seniors, etc. All of those reports will be rolled up into broader recommendations on from a bigger, from a systems level for future research and knowledge mobilization efforts in Canada. My thing is, we do not know where it will evolve from there. And so we always like to be clear on that. Like, our role in this space is to collect knowledge, to share that knowledge as best we can. And we have tons of faith in the Mental Health Commission of Canada and the Public Health Agency of Canada, mobilize it from there. But on some level, that might be work that you folks see not coming from us, but coming from outside spaces. And it does take a little while to trickle down into the real world sometimes. But our commitment as a company, as a business, as a social enterprise is that we do want to always mobilize what we learn above and beyond of the specific folks that we are providing that research to. And so we always want to share whatever we can because we know that service providers need access to this information in on an urgent timeline more often than not. And so we do keep a record of folks who engage in these processes with us, and we always try to report back to folks with an understanding of what was done with your perspectives, what was shared, what came out of your time and your contribution to this work, because we do value it genuinely immeasurably. And my last thing, as I think I've alluded to a couple times, is please don't be a stranger. I think we are, even if you are new to this world and you just need access to a resource, I can probably help send in the right direction or know somebody who can. I think a lot of the time we do this work in isolation, and the pandemic has made that worse. And so I always want to offer up to help connect folks to people, to share thoughts, to brainstorm, to find other ways to keep this work going. And so I think I'll leave it there and I'll give it a couple seconds or minutes for questions, and then we can wrap it up, and hopefully everyone can enjoy their evenings / afternoons / mornings, depending on your time zone. So any final thoughts or any closing comments from folks?
I just want to say thanks for this, because for me, it's kind of really like a good starting point for so much, and actually have a voice in it. It's really, really nice. So thank you for allowing, for having this go on. It's an important subject, and we have to keep exploring all avenues of it. Yes, our kids matter.
Thank you so much. And thank you also, I think, to the Canadian Public Health Association for pulling this together and working with us to host this webinar, to spread it across. They have always, every time we reach new people in new sectors across the country. And so it is a phenomenal partnership on our end, and we really appreciate their time on this. So thanks, Rachel and Greg. Any other thoughts or closing comments, reflections? Okay, I'm going to type in the link to I'm going to type in my email here just in case you don't see it on the screen. Folks are welcome to poke me if you do have any questions. I would also recommend checking out the Mental Health Commission of Canada website, because they've got a ton of phenomenal resources there as well, both specific to suicide prevention and broader and beyond. And I think we can wrap this up now. Maybe Rachel, I'll pass it over to you in a second. Thank you folks for joining us, for spending an hour or so sharing your perspective, weighing in on this conversation. Your voice does make a difference for us, and will help strengthen Canada's national research agenda and strategy on youth suicide prevention, and hopefully our knowledge mobilization efforts moving on forward from there. So Rachel, is there any closing comments on your end, or are we good to go?
No, thank you, Faye, and thank you everyone for participating. I know it was a different type of session, and I think I certainly learned a lot hearing from all of you, so I appreciate that. You can also reach out to CPHA at webinars@cpha.ca. I've put it in the chat. You know, if ever you forgot Faye's email, we'll make sure that we get you in touch with Faye, and as well as the other lovely folks at Wisdom2Action. And then just a last reminder, we will be sending out the slides and the link to the recording to all the registrants. So you will be hearing from us likely within the next week or two, depending on how long it takes us to edit the recording. But rest assured, you will hear from CPHA with the slides and the recording. And thanks again, everyone, and have a lovely afternoon.